Hello, friends. My name is Dr. Ngozi Onoha. I am the founder of Health for Naija. I provide health education content to a multicultural audience. And welcome to my channel, Health for Naija. If you're not subscribed, please click on the subscribe button and share and like. So, today I want to talk about what women 20 years and older should know about their health. So let's go on to this slide. It is a little bit busy. You can actually download the slide in the description of this YouTube video. So if you go there, I will have a Google Doc for you to download and you will download exactly this document. So let's talk about what is needed. So between the age of 20 and 39 years, a general checkup is recommended 1 to 3 years. Every 1 to 3 years. As women get older, so from 40 and up, they should schedule a yearly general checkup once a year. Now, from ages 20 and up, check your blood pressure every 2 years. If you have high blood pressure, you will need to have it more frequently as determined by your doctor or health provider. So, if you have high blood pressure, you may find yourself attending the doctor's office every 3 to 6 months, depending on how controlled your blood pressure is. Let's go on to breast cancer screening. Generally, between the ages of 20 and 39, breast cancer screening, which is a mammogram, is not needed for women of average risk. So, when we talk about screening, we refer to women who don't have any symptoms. So if a woman has breast pain or she has nipple discharge or she has a breast mass or lump, that is not considered a screening mammogram. That would be called a diagnostic mammogram. And those can be done at any age, but typically above the age of 30. If a woman who's under 30 has a lump in her breast, she would usually have an ultrasound of the breast. So, in women who are between the ages of 40 and 74, they should have a mammogram at least every year or every other year. Now, for women who have a strong family history of breast cancer, they may need to start their mammograms before the age of 40. But that's a discussion they would have with their healthcare provider. So, generally, in medicine, when we talk about screening, screening means that there are no symptoms. So, screening for a disease means that there are no symptoms and you're just doing a screening test. Now, if there are symptoms, then that test is now called a diagnostic test. So that's important to understand that we're talking about screening. So screening is for people who don't have any symptoms. So just a general check, and those are called screening tests. So let's go on to cervical cancer screening. And this is typically the pap smear, or in resource limited settings, it is called the VIA test, visual inspection with acetic acid or white vinegar. And also, there is just the high risk HPV test. So, typically, women from age 21 to 29 should get a pap smear or pap test or a VIA every 3 years. So, in that age group, the HPV test is not done. So HPV stands for human papillomavirus, and this is a virus that has been linked with cervical cancer. But in women who are 21 to 29 years, when they get a pap smear or a VIA test every 3 years, the test for HPV is not done. Now, from age 30 to 65 years, a pap test is done every 3 years, or a high risk HPV test every 5 years, or a combination of a pap test and the high risk HPV test every 5 years. They call this co-test because you're doing a pap test and a high risk HPV test at the same time. So, pretty much at the age of 65, if a woman has had normal paps without any questionable history or abnormal paps, and those screening for cervical cancer can be discontinued at the age of 65. But that's a discussion to have with the primary care provider. A fasting lipid profile will check your cholesterol. And again, this is screening. It can be started from the age of 20 and done every 4 to 6 years, depending on history. Screening for diabetes is done with a blood test called A1C or the fasting blood glucose test. So start screening from the age of 35 or earlier in women who are overweight or obese in that age group between the age of 20 and 39. Now, from the age of 40, this test can be uh, done every 3 years starting from age 45. It pretty much depends on, family history, whether they're overweight or obese. Let's talk about colon cancer screening. So, again, screening tests are done when there are no symptoms. So, typically, it is started at age 45. So, colon cancer screening for colon cancer to find little polyps that potentially can grow into cancer. So, that particular test is started from age 45, unless there's a family history and the colonoscopy might be done at a younger age. The bone density scan is a scan to test, again, screen for thinning of the bones, which is osteoporosis, that puts people at risk of fractures if they fall. So, in younger women, this is typically not needed. In people of average risk, typically the bone density scan, which is called the DEXA scan, is started at the age of 65 and as recommended by your provider. So I hope you found this useful. The Well Women checks, what checks women should have starting from age 20. And we're talking about screening tests. So, my name is Dr. Ngozi O. I keep you educated and informed. My platform is Health for Nigeria, where I provide health education for a multicultural audience. This is medical education and it is not medical advice. Please subscribe, share, and like. Thank you so much for listening, and bye for now.